Hi, everyone. This is Peter Morley, your patient advocate, and I'm talking today to congressional candidate Matt Castelli. Matt is running in New York's 21st district. So, Matt, I understand that you have some experience in healthcare.
That's right, Peter. Yeah, I spent much of my career doing counterterrorism work at the CIA and at the White House. But when COVID hit, it marked another watershed moment to step up and serve. And what I first did was I helped to start a small nonprofit at the very beginning of COVID to help secure PPE for doctors, nurses, other frontline healthcare workers, particularly those working in safety net hospitals across the country. But as the pandemic raged on, I actually left government and I joined a healthcare startup here in New York that's working to help veterans, seniors, rural populations better access care and services by connecting health and social care together. And it was in this experience, I worked for this company for about a year and a half or so, where I learned so much about social determinants of health, and that it's our human and social service providers in the community that play such a vital role in our overall health and well-being.
Well, thank you so much for doing that. So what would you do in Congress if you were elected to make it easier for folks to access healthcare?
Yeah, well, when we're elected, we're certainly going to be focusing on lowering costs, specifically around prescription drugs and care overall. That's important. It doesn't make sense that other countries can negotiate for prescription drug costs and we can't. That's something we want to be able to provide a solution to. But here in much of our district, in the 21st Congressional District, it's very rural. And it's in our rural communities where it's not necessarily a question about how do we pay for it, it's about how do we access it. And how do we access the care that you need when and where you need it. Clinics have been closing across our community. We've got entire counties here in the 21st Congressional District that don't have maternity wards, and where folks, whether they be seniors or veterans, have to drive over an hour to get to the doctor or to see a mental health provider. And this is something that we really need to fix urgently. So from my perspective, we need to spend some time, energy, and resources really focusing on making sure that care is available throughout all of our rural areas. And that can come through things like innovation, whether that's telemedicine and having the backbone infrastructure or broadband services to make that happen, or thinking about innovative models for distributive care, whether that's maybe focused on a school-based system. These are the kinds of things that we can ensure provide a greater degree of access to care throughout our communities. And as I mentioned, based on my experience, we want to make sure that it's not just acute clinical healthcare, it's also about a full suite of services from our human and social service providers to make sure that we're keeping people healthy and actually out of the hospital. And unfortunately, here in our district, our current incumbent Congresswoman Elise Stefanik, she's opposed bringing funds to our district to support clinics, to support hospitals, to prevent those kinds of closures. She's opposed funding for the kinds of tools we need, like broadband, to actually make telemedicine or remote sensing for elder care to make that possible. Stefanik even was someone who was the architect around the plan to gut Medicare. And so she's someone who's interested in putting vulnerable seniors in danger of losing their health care. So fixing rural healthcare, protecting our Medicare, those are top priorities for me, because access and affordability, these are the kinds of things that are going to be really important to make sure that we can take care of ourselves, our loved ones, and each other.
Well, Matt, as somebody who is on SSDI and I'm on Medicare, you'd be helping me too. So thank you so much. And I'm rooting for you here from New York City.
Thank you so much, Peter, for the opportunity to chat with you today. We're all in this fight together.